This interview is brought to you in association with Rabobank.
Hello and welcome to another online rural delivery interview. I'm Roger Bourne and with me is Dr. Joe Scott-Jones, Chair of Rural Health Alliance Aotearoa. Joe, good to speak with you again.
Nice to talk to you again.
Joe, I understand that you're travelling at the moment, so thanks for bearing with us today. Great to talk to you. You're very new in your role as Medical Director of Pinnacle Midlands Health Network. You've got a long CV, you do a lot in the rural health space. I won't read it all out now, but what I am reading from that is that you and other rural GPs are very busy people.
That's very true. There's a small bunch of us, and we tend to be quite passionate about what we do. Because we love living and working and helping in rural communities, I think.
You've had some mixed press recently based on, there's one of your colleagues in Tokoroa who's been trying to find someone to take over his practice or join him in his practice and been bemoaning the struggle he's had to bring people on board. I understand, though, that there is quite a lot of work going on at a range of levels to raise people in the medical profession's viewpoints on what it's like to be a rural GP or a medical practitioner in a rural community.
That's right. The New Zealand College of General Practitioners has recently done an extensive workforce survey and looked particularly at rural New Zealand and the pressures. And our colleague in Tokoroa is not alone. The latest figures are suggesting that 40% of rural practices in New Zealand are looking for a full-time equivalent GP, and we know from previous surveys that we've done that around 20 to 30% of practices are looking for full-time nurses. So the workforce issues seem to be getting worse from the figures that we're looking at. And really that feeds into an idea that we have to do things differently. The college and universities are really aware of this problem and are putting a lot of focus on trying to address that issue, encouraging people into general practice to start off with, and then also exposing them to rural practices during their training, with the hope that they'll choose rural and provincial New Zealand for their futures.
Are there any specific programs that look at grabbing young people within the communities to begin with and setting their sights potentially on a medical career?
There are focuses particularly for Māori and Pacific Island students at high school, where they're identified as having an interest and then brought in for a week of experiencing university life. They get exposure to the different sort of options that they have in terms of health careers, which is a fantastic idea and certainly has an impact on making people realize that this is a future that they could have, and helping them to focus on putting the work in at the very early stages so that they get their university entrance and so on. Once they get into university, then there's a whole range of support platforms, but that are some of which are student-led. Each of the universities have a rural health club where people from rural backgrounds get together, and we encourage them to come out into the rural areas and for a weekend. We've got one coming up in Whakatane in the next few weeks. We'll take them kayaking and we'll stay on a marae. We'll show them the hospital and get them interacting with each other and also with local health professionals. So these sorts of initiatives just open people's eyes to the idea that this is a good choice and a fun place to be. Where you can get a great education and live a fulfilling life.
It's a fairly well-worn plot line. City doctor ends up in a rural practice. It struggles with the quirkiness of his or her new patients, but generally goes on to have a merry adventure. What is the reality for somebody? Are you looking for people to move out of the city to take up these roles, or do you find in general that people who generally have a rural background to begin with, and that's what attracts them maybe back onto into that sort of lifestyle?
I think there is a move when people who've been maybe city doctors come to the thinking about retirement or slowing down, that some of those people will come out into rural areas. A lot of people who've got rural interests, tramping, cycling, sailing, they can achieve those things really well in rural communities. So, there is a little bit of a trend to that, but basically recruitment is around identifying people early on, exposing them to rural communities throughout their training in undergraduate and providing them with support in their postgraduate years, so that in that early phase of sort of forming a family and forming your early professional identity, you do that within a rural or provincial place.
Do many people come to general practice as a second career? I'm just wondering whether or not if you were to target people who were, in their late 30s or 40s who might be entering medicine for the first time, they might be more open to that sort of thing, having got their early career out of the way and the city out of the system.
There's certainly really good evidence around postgraduate entry into medical training. Shows that people who come in with that focus at postgraduate, they've already made those life choices. They're making a choice to become a doctor. They've sorted out all of the other stuff that they need to do in life, and they tend to then follow through with their plans. So yeah, there are some postgraduate schemes at both universities, but there's definitely room for that to be expanded, I think. Particularly, and so you take in people who are saying, yes, I'm really interested in this area of high need in terms of the profession and general practice, and particularly in rural general practice or work with Māori or Pacific Island communities, the other high needs communities that we have in our country.
What role for technology then?
It's going to be very, very interesting seeing what technology does in the next 5 to 10 years. There's already programs on the ground that are, the patient portals are a fantastic idea for increasing people's access to their own health services. My patients can look at their results online. They can email me with questions. They can ask for results. They can ask for prescriptions. They can organise appointments all online. The next step is going to be video conferencing. Being able to book a virtual consultation online, the technology's there. I was looking at the college conference a couple of weeks ago, and there are providers that are already providing that facility. So it's just how we make that happen for people, really. Anything that we can do to improve access is going to be good.
Technology in particular, it might be hard to deal with a broken leg via the internet, but, things, like, as you say, like diagnosis. What about mental health? There should be a really good connection there where you might be able to develop connections with people. It's, the technology's proven as a way that people are prepared to share more than what they might even do face-to-face. So maybe there's an unexpected upside.
Yeah, and the NHS in the UK has shown that virtual psychological services can be very effective and acceptable to people. I think the key thing with those sorts of services is that they should augment and help the services that are currently in place rather than be thought of as complete replacements. I think if you look at some of the Australian models where they've tried to use telemedicine as a complete replacement for a service, it's not been as successful as you would have thought. So there's a lot of complexity in it. I think ensuring that there's still a face-to-face relationship that people can develop with the provider is probably a really key thing within that. But the ongoing support, the follow-up care that otherwise would involve 2 hours of travel from either this patient or the specialist, that can be done online.
Joe, I know you have to get on, but I've got one last question for you, and that's about the demand side. Do you have a viewpoint on how rural people are managing their health at the moment? Do we know how healthy they are? Do we know if perhaps a lack of availability is causing real problems. So one thing is what the data is telling us, and secondly, I guess anecdotally, are these rural people able to manage their health? Is it top of mind for them?
I think rural people, if you look at changes in attitudes around disclosing mental health issues, I think the impact of things like the Federated Farmers Life a Bitch campaign and Doug Avery and people and the Mental Health Foundation, what they've been doing has been having a definite impact on opening people's eyes to the fact that it is okay to go and talk about how you're feeling with your GP. So I think that we're seeing changes in behaviour as a result of those sorts of things. So that, particularly around mental health issues, we're still, trying to get young men to come in and admit to something. That people do tend to wait longer in rural communities, and they present later with issues, and they present often with more issues at any one time, which of course increases the demand on the services. We know that things like access to when people present for with breast cancer or bowel cancer, they tend to present at a later stage in the disease if they come from a rural community. So there's a lot of work that we can do there in terms of getting people to change that behaviour. One of the problems that we have is that we don't have a lot of data around these sorts of issues, and there's a big space for us to improve that. If we can't measure it, we won't change it. It makes sense to us that the further you are away from a service, the less likely you are to use it. But is that really true? If it is true, what does that mean for the way that we provide our services in the future? And so there's quite a lot of work to do on that. But yeah, I think it is changing, particularly around the mental health issues.
Well, that's heartening to hear. Joe, I'll let you go, but I'm very interested in this issue and I'd like to stay in touch with you on it. Thank you very much for your time today.
Thanks, Roger.
This interview was brought to you in association with Rabobank.